welcome you to all to our third talk of this year, in which the topic is Tourette syndrome, which will be presented by Marohadatul ICBD Umar. And I hope that this will be a beneficial talk to us all. And without further ado, we'll welcome our presenter to begin with the talk.
Assalamualaikum and good afternoon everyone. Thank you for sacrificing your lunch time to attend my talk this afternoon. Without further ado, let's begin the talk today, which is about Tourette syndrome. Today I will be talking about the definition and origin, diagnosis, causes, symptoms, co-occurring conditions, and treatments. Well, to the outside world, it can appear to be something of a joke, but Tourette's is no laughing matter for those living with the syndrome. Sufferers' lives are forever marked by the constant, uncontrollable urge to shout, swear, and tic inappropriately. And to have to do the tic every second, for them, it is definitely tiring. They also would have difficulty in eating, falling asleep, and studying. When 1 in 100 children have some form of Tourette's, that is the same amount with children with autism. It is named after Dr. Georges Gillet de la Tourette, a pioneering neurologist who first described the condition in a French noblewoman. So what is Tourette syndrome actually? It is a problem with the nervous system that causes people to make sounds, sudden movements called tics that they cannot control. It is sometimes known as multiple tic disorder or tic spectrum disorder. So basically, tics are just the symptoms of Tourette's. I'll talk more about that later on. There is no specific lab test or other medical study that can diagnose the Tourette's. Doctors make the diagnosis after verifying that the patient has had both motor and vocal tics for at least 1 year. The existence of other neurological or psychiatric conditions can also help doctors reach a diagnosis. Usually, diagnosis is made through observation of an individual's symptoms and by assessment of family history. The process of making a diagnosis usually involves monitoring symptoms over a period of several months. This period of observation will help determine the extent to which the symptoms are interfering with the person's ability to function at home, school, and in the community. In rare cases, neuroimaging studies such as MRI, that is magnetic resonance imaging, or electroencephalogram EEG studies, or certain blood tests may be used to rule out other conditions that might be confused with Tourette's when the history or clinical examination is atypical. Experts are not exactly sure what the cause is, but is believed to be an inherited genetic condition and the disturbance in the balance and the function of the brain's neurotransmitters, which are chemicals in the brain that carry nerve signals from cell to cell. Tourette's affects males 3 to 4 times more than females. However, in about 10 to 15% of cases, Tourette's is not genetic. Researchers' current investigation points to the abnormalities in certain brain regions, such as the basal ganglia, frontal lobes, and the cortex. Basal refers to the basement of the brain. The basal ganglia is responsible for involuntary movements, emotion, and learning. Abnormal neurotransmitter levels may disrupt normal brain function, resulting in tics. A risk factor is something which increases the likelihood of developing a condition or disease. For example, obesity significantly raises the risk of developing diabetes type 2. Therefore, obesity is a risk factor for diabetes type 2. So what are the risk factors for Tourette syndrome? Genetics. If a close relative, for example sibling or parents, has Tourette's, that person's risk of developing it is significantly higher compared to other people. Premature birth. Babies who are born prematurely have a higher risk of developing Tourette's. The main symptoms are tics. Tourette's causes people to have tics. Tics are sudden twitches, movements, or sounds that they do repeatedly. It is important to understand that these are chronic, which means long-term and involuntary. Tics usually start around the age of 7 and are usually worse between 10 to 12 years. However, in approximately half of patients, most symptoms disappear by the age of 18. Tourette's is a persistent disorder, but not always greatly disabling. Tics seen in patients with Tourette's can range in intensity, frequency, duration, type, and complexity. There are two types of tics, which are motor tics and vocal tics. The first tics often start around the head and face, which is motor tics. It usually occurs around the age of 5 to 10 years old. Motor tics are associated with movements such as eye blinking, shrugging of shoulders, neck stretching, facial grimacing, rolling the eyes, mouth movements, jaw clenching, and speaking. While vocal tics tend to appear later, around age 11, and are associated with sounds such as barking, sniffing, throat clearing, and coughing. Tics can also be categorized as simple or complex. A simple tic is fast and purposeless. The examples are shown in the slide. A complex motor tic consists of movements that involve multiple muscle groups with a purpose, such as scratching, throwing, chewing, head banging, which can easily harm a person, whereas a complex vocal tic involves meaningful words, phrases, or sentences, not just a sound. Less than 10% of people with Tourette's swear, which is known as coprolalia. It is uncommon for people suffering the syndrome. In many cases, a person with Tourette's will have a combination of vocal and motor tics, which may be simple or complex. No two people with Tourette's will have the same tics. Each person will be as different as every snowflake. The majority of patients experience unusual or uncomfortable sensations before the onset of a tic, similar to that of a sneeze or an itch. They describe it as buildup of tension, pressure, of energy. The actual tic is a means of releasing or relieving this tension. Examples include: the eyes have a burning feeling which can only be alleviated by blinking. A gradually growing muscle tension which can only be alleviated by stretching or twitching. The throat starts feeling dry, which can only be alleviated by grunting or clearing the throat. A limb or joints becomes itchy. The only relief is achieved by twisting it. Tics can also be dangerous to a person. The following situations may cause tics to be worse: anxiety or stress, fatigue, illness, and even excitement, which can cause panic attack. All tics come out at the same time. More than 79% of people with Tourette's also have co-occurring conditions such as ADHD, OCD, anxiety disorders, and behavioral problems. ADHD is short for Attention Deficit Hyperactivity Disorder. Symptoms include difficulty in staying focused and paying attention, in controlling behavior, and hyperactivity. This causes them to have problems with reading and writing. It is estimated that ADHD occurs in as many as 75% of individuals with Tourette's, whereas OCD is short for obsessive compulsive disorder. It is a mental disorder where people feel the need to check things, perform certain routines, or have certain thoughts repeatedly. People are unable to control either the thoughts or activities. Examples include excessive hand washing and repetitively checking to see if a door is locked. Anxiety is one of the most common symptoms and can lead the individual to believe that if a task is not completed, something bad may happen. In patients with Tourette's, onset of OCD usually occurs before puberty, and it may lead to serious impairment. Are any of you annoyed by this picture? And that's one of the many forms of OCD. I will show you a short video of an individual with Tourette's who also have an OCD in a moment. So you have seen that the boy named Mason claps his hands several times. But why does he keep stopping? Because he's doing it wrongly. He has to clap 4 times, and every 4 he has to clap 4 times. So he has to do 4 fours. Did you get what I mean? He has to clap 4 times, 4 times. So overall, he has to clap 16 times perfectly. And if it doesn't sound right to him, he has to do it all over again. And don't ask me why, because that's OCD. Moving on, in this slide, I will be talking about a girl named Jessica Thom, who also known as Tourette's hero. She was diagnosed with Tourette's at her 20s, but she has had tics since she was at her early 6s. With some encouragement from her friends, Jess decided to turn her tics into a source of imaginative creativity, and that's how the Tourette's Hero Project was born. So why is she a biscuit girl? Although she does not particularly care for biscuits, the word has become the most common of her tics. She says it hundreds, if not thousands of times every single day, often while punching herself in the chest. In any situation, she has no idea what might come out of her mouth. Her brain makes her do it by controlling her arm and mouth to do the tics. Also, she had to wear gloves to protect her body and hands from a long-standing chest-banging tic, a padded glove to cover her knuckles. Treatments. There is no cure for this syndrome, and there's no drug out there specifically made for Tourette's. However, the condition in many individuals improves in the late teens and early 20s. As a result, some may actually become symptom-free or no longer needed medication for tic suppression. Although the disorder is generally lifelong and chronic, it is not a degenerative condition, meaning that the individuals with Tourette's have a normal life expectancy. Treatment is crucial in helping the affected child avoid depression, social isolation, and strained family relationships. However, many people do not seek medical attention because the symptoms are so mild. Medications may be taken to minimize the impairment caused by Tourette's. Behavioral treatments such as tic awareness training and computing response training can be used to reduce tics. And also sportive therapy, which hasn't been shown to reduce tics, but it can help a person with Tourette's to better cope with the disorder and the social and emotional problems that may occur because of it. Additionally, tics tend to cease when the individual is absorbed in an activity or task that requires concentration, such as singing, reading an interesting book, acquiring relaxation techniques, engaging in competitive sports, playing an enjoyable computer game, which involves a high level of concentration. In some cases, however, overexcitement may cause tics. And that's the end of my talk. Do you have any questions?